Hello friends, I am Dr. Anurag Shrimal, liver, kidney, pancreas, intestine transplant surgeon and currently practicing at Mumbai. My area of specialization includes adult and pediatric liver transplantation, kidney transplantation, pancreas transplantation, intestine transplantation and complex hepatobiliary surgery. Today I am going to talk to you about the liver transplant surgery, who needs a liver transplant, what are the various forms where a liver transplant can be done, and how is life after liver transplantation? These are very common questions that I face during my meetings with all my patients and their families. So let's start with the first question. What is a liver transplant? Liver transplant is a surgery where the entire liver or the entire affected liver, diseased liver, is removed from the patient's body and a healthy liver is put inside the patient's body. In this process, first we remove the liver, we put the new liver in, and we make connections of the blood vessels, of the bile ducts. The moment the blood flow is re-established, this new liver starts working and we can see parameters changing in the patient immediately after what is called as reperfusion. Not just one of the most complex, this is the most complex surgery in a human body, that is living donor liver transplantation surgery. The question comes next is, who needs a liver transplant? Now there are multitude of conditions where a patient would need liver transplant. We can broadly divide them into two categories. One, what is called as an elective liver transplant, and one, what is called as a emergency or a super urgent liver transplantation. Coming to the first part of it, which is a elective liver transplant. Now these are patients who would be either walking from home or who are admitted at the hospital being stabilized and then undergo a liver transplant operation. The common conditions or the common diseases where a patient may need liver transplant includes, we are the diabetes or we are the fatty liver capital of the world now. So the most common condition is metabolic or NASH related cirrhosis of liver. Because of long-term accumulation of fat and the toxicity associated with it, the liver is damaged and it becomes shrunken, hard, nodular, and this condition is called as cirrhosis of liver. When a patient starts developing complications of cirrhosis, they need a transplant. The most common condition, as I said, is fatty liver disease in our country or NASH or metabolic associated liver disease. The next conditions that we see are hepatitis B and hepatitis C virus related liver disease. These are viruses which are called as hepatotropic viruses or which lives in the liver, and over a long period of time, sometimes 10 to 20 years or even longer, can cause damage to liver, leading to cirrhosis of liver and also predispose to formation of cancers in the liver, what is called as hepatocellular cancers. Alcohol. So it's a myth that alcohol is the most common reason for cirrhosis of liver. I agree with you that consumption of any amount of alcohol causes damage to the liver. In our country, alcohol is now becoming the second or the third common cause for cirrhosis of liver and hence the need for liver transplantation. Other common diseases includes autoimmune liver disease, Wilson's disease in adults. So as I discussed with you, the other set of group or the other set of patient who require a liver transplant is what is called as acute liver failure, or these are the patients who would require a super urgent liver transplantation. In very simple words, what is acute liver failure? A healthy individual like you or me gets an injury to the liver, whether it's an infection or whether it is sometimes some poison getting consumed, whatever it is, in a very short span of time, there is extensive liver injury leading to liver necrosis and the liver is not able to sustain the functions of the body. This patient who's a healthy individual today, in a short span of few days, will develop jaundice, will develop altered sensorium, what is called as hepatic encephalopathy, and will develop the blood getting thin because the synthetic function of the liver is affected. So this combination of a severe form of liver disease giving rise to jaundice, hepatic encephalopathy, and coagulopathy is called as acute liver failure. This is a life-threatening condition. These patients are best managed at a liver transplant center. Without a liver transplant, around 15 to 20% of these patients, or only 15 to 20% of these patients, may be salvaged with medical therapy where the liver regenerates. But most of them, or around 80 to 90% of them, would require a liver transplant After a liver transplant, almost 90 to 95% of them recover and do well in their long term. So friends, these were the two common causes for liver transplantation. One is cirrhosis of liver or cirrhosis and hepatocellular carcinoma. And the second group of patients, which is acute liver failure, a healthy individual developing a sudden hit to the liver and requiring an emergency liver transplantation. Friends, thank you for watching my video. Do subscribe for important information and updates about liver health and liver diseases. Don't forget to like my video. Thank you for watching.